Well, welcome into To Your Health. It doesn't take very long to realize the fact that we've had some problems around the state of Alabama. A lot of those problems seem to center on people that are older. And of course, some of those people happen to be in nursing homes. So today I have with me John Maston, and you are the communications director for the Alabama Nursing Home Association.
That's correct. Thanks for having me.
Well, I'm glad to have you here because we should have been talking long before today.
Yeah.
Because my audience is obviously persons that can wind up in the nursing home. It's an interesting fact, John. They talk about the number of older people that are dying from the virus. But a question that I would normally have is, in a given year, like the first quarter of any given year, there's going to be so many people that are going to die in a nursing home anyway.
Well, Jack, we care for individuals that are very medically fragile.
Absolutely.
And they're often very elderly.
Yes.
So if you're someone that's, say, 95, 97, the oldest person I've ever known to live in an Alabama nursing home is 111 years old.
Wow.
So if you're 95, 97, the typical long-term care age in a nursing home, and you probably have 3 or 4 medical conditions.
Yes.
Unfortunately, you just don't have that much time left to begin. Now, certainly your life needs to be fulfilling and you need to receive good medical care, and that's what our nursing homes do. But it is just one of the facts of what we deal with. We're caring for people who are very fragile and very elderly.
Yeah. So, like I say, in any given year, you're going to have deaths. Probably, because there are over 300 nursing homes in Alabama, are there not?
There's 231 nursing homes and a
231,
little over 300 assisted livings. There's at least one nursing home in every county, Jack, so your viewers out there can know that the care they need is close to home. They don't have to go far to find a nursing home.
And that's great. That's the way it is. But like I say, in a given year, and normally January, February, and March, you may have as many as 80 people that die just naturally. When I say naturally, I mean the fact that they're at that age and we're not going to live forever, so they are going to die.
Yeah, and also this is flu season.
Yes.
Flu season comes around every year, and
yes,
that's a very difficult time. Of course, COVID-19 came through right around the time flu season was really picking up. So our nursing homes are already on guard, practicing those infection control protocols, doing all those things you would normally do for flu season, and just had to step that up another level to meet the challenge of COVID-19.
So all of a sudden, bingo, you've got this affecting you. I think one of the main things that has to happen in a nursing home, because I've visited nursing homes, both as Ronald McDonald as well, that when I did that years ago, but as just seeing people that are in my church that happen to be in a nursing home, they need to have physical contact and they need to have people.
They do, and that's what makes life.
That's the sad part.
Yeah, that's what makes life so great in a nursing home is you have church groups, civic groups, you have your friends and family coming to visit.
Yes.
There's something different happening every day in a nursing home. And of course, once COVID-19 came in, a lot of our nursing homes knowing you needed to stop community spread, restricted visitation. Then we came under a federal mandate from the Centers for Medicare and Medicaid Services, and then also the state health order to restrict visitation. Now, thankfully, we live in a day and age where technology is everywhere, and we can, and thankfully we have ways to video chat. Phone calls are still available. A lot of our nursing homes have found ways to do visits, sitting on either side of a big window and giving them a communication device to talk to each other, or maybe having a courtyard area where you can sit on one side of a fence and the family member can sit on the other side and maintain that proper social distancing. We've seen a lot of nursing homes do parades. That's great. Every nursing home resident has a mask and they're socially distanced in the parking lot and around the drive, and the cars come through several times and wave. And so we're finding ways to keep that quality of life up. Certainly not like we would want it to be, but we're trying to do everything we can within those guidelines to still provide that quality of life and the personal touch, which is so important.
I hate the word social distancing. I just call it personal distancing because we still have to be sociable.
Yeah.
Social distance means I'm not going to talk to you.
Yeah. Well, physical distancing probably would have been a better term if we had time to study this out coming on. But you're right. Be physically distant and be socially close. Make those telephone calls, have those video chats, and that goes if you're in a nursing home or not. Make sure you're staying connected with the people that you love and care about and that love and care about you.
From your perspective, you've got things pretty much under control, do you not?
We're doing well. Our nursing homes are working hard. They're holding their own. The good thing about it is COVID-19 got to Alabama later. That helps you learn from what other states did.
Right.
And of course, it gives you more time to prepare. Of course, now while you're starting to prepare, all the supplies are being used up in other parts of the country. But our nursing homes have held their own. They're working very hard. They're very diligent. However, we see this being something that could be with us for a while. It very well may be June or July before those visitation restrictions are lifted by the government. From what we understand, and we don't know everything yet, but from what we're hearing from the Centers for Medicare and Medicaid Services and the CDC, is that you'll have to have a lot more testing in place, community-wide, statewide,
Right.
and then you also got to make sure you got the personal protective equipment in place. Trust me, we want to open those doors up as soon as we can
I
and
know.
get life back
I
to
know.
normal. But we've got to make sure we're doing everything we can to combat the spread of COVID-19.
When they're looking at numbers in nursing homes, are you included with the Alabama Department of Veterans Affairs? Those homes, are they kind of separate from?
They're, the veterans' homes, there's
Yes,
4
there's-
state veterans' homes. They are
right.
licensed as a nursing home by the state of
Yes.
Alabama, and we're very fortunate that they're members of our association.
Okay, okay.
94% of nursing homes in the state of Alabama are members of the Alabama Nursing Home
Good.
Association. That includes the veterans' homes.
very
We're
nice.
proud to have them.
Good, good. So basically, if they're giving numbers, then those, because I know that, and I live in Elmore County, and I've been told, when you, and I'm a veteran, so they said, if you're going to go anywhere, go to that Bill Nichols place in
Yes.
Alexandria. That's where you need to be. And of course, I still plan to go there
Yeah.
if I need to be going to a nursing home. But they've been hit exceptionally hard, and that skews a lot of the numbers too.
It does, and when you look, Harvard Medical School did a study on nursing homes and COVID-19
Right.
impact, and the number one correlating factor was the nursing home being located in a COVID-19 hotspot. Didn't matter about inspections,
Yep.
didn't matter about ratings, didn't matter about the size of the building, the acuity level of the people residing there. It's all about being in a hotspot. And of course, Tallapoosa County became a hotspot because of the spread that came
Absolutely.
from Chambers and Lee counties. Bill Nichols State Veterans Home, those folks have worked around the clock,
Yeah, they
worked
sure
very
have.
hard. As
Yep.
you may be aware, the Alabama Department of Veterans Affairs got the federal Veterans Affairs to come in and inspect
I know.
it. Got a special inspection by the Alabama Department of Public Health.
That's right.
And neither one of those found anything. They said Bill Nichols is doing everything they possibly can be doing.
That's
that
great.
just shows you how serious we need to take COVID-19.
Amen. Well, John, I appreciate you coming by. And just remember this, if you have a loved one that's in a nursing home, all the mandates that keep you away from your loved one is not the nursing home being the bad guy. They're doing what they have to do to protect everybody in that home, and they're going to have things up and running because that's their goal. And we'll be right back right after this.